So worldwide, over 400 million people are diagnosed with diabetes today. And within this population, 1 in 4 are actually living within India. So clearly, this is a target population that we need to address this non-communicable disease in. So what are we doing about it? Well, the first line treatment for diabetes is lifestyle modification. So changing the diet and the exercise. And then if this fails, we move on to medications and then insulin injections. But we want to prevent patients from progressing to these medications because not only do these pose a significant burden in terms of cost, but they're also a significant disruption to the patient's life, and it's actually really painful as well. And yet, despite this, in India, 90% of diabetic patients did not receive adequate self-management education. So what are the barriers to diabetes management? Well, first of all, there's the poor health awareness, but in addition to that, healthy eating takes time and changing habits is hard. So that's where our solution comes in. Eat Smart. So this is an all-in-one solution for diabetic meal planning as well as education. But wait, aren't there already recipe apps out there? But with the existing recipe apps, many of these are simply just a recipe browser, and there's no integrated solution that offers automated meal planning, and it doesn't individualize these recommendations to the patient's own preferences. And none of them offer diabetes education. So how are we doing this in our solution? Well, we begin by asking these patients what they currently eat. And we'll be targeting foods that are common within India that diabetics now need to avoid following their diagnosis, such as basmati rice. And in addition to all these other recipes, we will then generate a tailored education based on what healthy substitutes for these staple foods, such as replacing rice with millet as the carbohydrate staple. And we'll also be providing written education as to why diabetes management is important and how they can eat healthy. So we'll also generate a personalized weekly meal plan for these patients, which they can adapt by switching out the recipes if they don't like them, and by machine learning, where the patients are able to give a rating to these recipes, we will then tailor future recommendations to patient preferences. We will also be generating a grocery list for patients, and by partnering with local supermarkets, we can offer these patients the lowest prices for each of these ingredients. So our project also has applicability to expand to other non-communicable diseases with dietary modifications, and it can also apply to more than just India to support Eat Smart.
Oh, well done. No, I think it's very valid in today's world, especially in India, where a lot of the food encourages diabetes and various other health diseases, and people are not aware. Have you thought of how you work with different cultures over there? Because a lot of the food relates to the family upbringing and the areas that they live in. It might be limited.
Yeah, that's a very good question. Thanks. So many of the current recipe apps are actually like globalized. Like if I open a recipe app and you open a recipe app, it's probably the same. So what we aim to do is that for each location, we want to actually speak to the local community and see what are the most popular foods in that local community. And so, for example, if you're in like Mumbai and then you open our app, we will specifically show those questions that are Mumbai specific. Yeah.
So we hope to partner with nutritionists that live in India to make sure that all these recommendations are tailored to the local culture and their foods. And also, one of the things we didn't mention is when they create their user profile, we're actually going to ask them things such as which part of India are you from, and do you have dietary requirements like vegetarian or any allergies, and then tailor recommendations based on that as well.
That was great. So how are you going to assess the success of this?
Okay, so in order to assess this success of this, so we let all the diabetes patients sign up, so through our medical staff. So we actually firstly talk to the medical staff, like for example the doctors in India, in order to sponsor our app. So for example, if you're a doctor, we'll tell them, please tell your diabetic patient, please install Eat Smart.
And to actually measure the success of the app, we can do this by just monitoring the amount of users and how many times each user uses the app and how many times they click through the recipes, they change the recipes. Yeah.
So one thing you didn't address is the business model. So how do you make money out of this?
Yeah. One of the so if you saw before, like the local communities, we wanted to connect with local communities. Many of the other apps actually just globalized. So what we want to do is we want to talk to the local community and provide the prices for the lowest prices, and then we can charge like some sort of revenue stream, like maybe 5% or something of all their costs. We also have a premium subscription service where we provide extra stuff. So we provide a larger recipe range than the free version. So currently it's for free, but